Well, Australia is suffering through a giant sleep hangover. Sleep deprivation is costing the economy more than $66 billion a year, and it's deadly. A Deloitte Access Economics health survey has found 4 in 10 people go to work each day without getting enough sleep. So to discuss this further, I'm pleased to bring in our resident doctor, Tamara Hunter. Hi there, Dr. Hunter. Now, poor sleep patterns cost our economy about $66.3 billion in health bills, lost productivity, well-being. Like, sleep deprivation is obviously a serious problem for us Australians.
Yeah, it was quite striking to see that 40% of Australians have a sleep disorder, and that actually includes sleep apnea, which is one of the most common things we know about. But to think that there are other things that are going on with people such that they're fatigued and impaired going to work. We know that 5 hours sleep a night, you're going to have significant impairment in your mental alertness and your cognition skills. In fact, going 24 hours with wakefulness is actually equivalent to having a blood alcohol level of 0.1%, which is kind of double what we should be driving on. Even chronic loss of sleep, so a loss of say 2 to 3 hours per night, is known to increase the risks of heart disease, stroke, type 2 diabetes, even breast cancer has been associated with lower sleep and also a shorter lifespan. So this is quite impactful both on our economy but also on the livelihoods of Australians.
What are some of those things that are stopping us from sleeping well?
Well, it's many and varied. There's the lifestyle thing, so people are working shift work, which resets our sleep habits, much longer hours. People are at work for much longer hours now, and the stress associated with that fast-paced lifestyle means that people are not getting good quality sleep. There are also medical conditions, so we know, for example, that menopause can induce sleep disorders, sleep apnea, as we've discussed before, getting up to go to the toilet in the middle of the night, children. We know that having children who wake through the night also disrupts our sleep. So there's many and varied issues.
I know most people don't necessarily like the idea of medication, but what advice can you give people if they're wanting to get something to help them sleep well?
So humans are not very good with a sleep debt. It's very hard to regain that sleep back. So I would always suggest that if you're losing 2 to 3 hours a night, we should be having on average 8 hours, then probably trying to go to bed earlier on subsequent evenings would be a good idea, particularly if you know you're going to be getting up to small children. Making sure your sleeping environment is conducive to sleeping, so not going to bed with the iPad or the iPhone, for example. Using relaxation techniques is really valuable, maybe even earplugs if you've got noisy neighbours, and if you think there is something underlying that may be impacting, then definitely sit down with your general practitioner and discuss it.
Okay, love the advice. Thanks for coming in, Dr. Hunter. It was good to see you.
You too.